More than 1 year in, this is the next great challenge in our pandemic. The herd hurdle, how Chicago and the nation will get enough people vaccinated to protect the population as demand for the shots has plummeted, and how to handle vaccine holdouts who are making herd immunity so difficult to reach.
What you mean why I don't want to get it? Because I don't want to get it.
I mean, it ain't gonna hurt you.
It might.
It's saving lives.
No, it ain't.
Yes, it is.
It's a vaccine debate that grassroots community organizer Diane Latiker says she is having more often than she'd like, impinging President Biden's new vaccination goal of at least one shot into 70% of adult Americans by the 4th of July.
Can I leave this with you?
Latiker is founder of Kids Off the Block, an outreach program that pivoted to street-level canvassing, encouraging residents in Chicago's Roseland and Chicago Heights communities to get vaccinated.
I want my community to count in health. Don't bypass them because of their economic status or where they live, the color of their skin.
Latiker worries about the growing trend of vaccine avoidance among younger adults.
The millennials, the Gen Z, they didn't want anything to do with the vaccine because all of this misinformation online. It's so in your face every day on social media.
I don't trust it.
Vaccine holdouts aren't just young people. 49-year-old LaVince Person says he's seen warnings on social media and he's not getting the vaccine.
I've seen different clips on people talking about how it's dangerous, and I kind of believe it.
His brother, who works in healthcare, did get the vaccine.
We got two different opinions, so he chooses not to take it. That's on him.
Whether on the fence or dead set against it, millions of holdouts could upend progress against COVID-19.
If we have more people that decide not to get vaccinated, then there's going to be more opportunities for the virus to mutate and evolve and come up with different variants. Do they show protection?
Pablo Penaloza McMaster is a vaccine researcher at Northwestern Medicine. Here in his lab, scientists are working to create future vaccines that will increase the immune response to the virus. Right now, he says current vaccines are safe and effective.
Thinking that vaccines don't work is kind of like ignoring history. And the only way to get rid of this pandemic completely is by everyone getting vaccinated.
Illinois is on par with the rest of the country, with about 1/3 of the state now fully vaccinated. Although a slowdown was always predicted, in some parts of the state the decrease is more prominent. An I-team analysis of IDPH data since vaccine demand peaked statewide in mid-April reveals in the southern region of Illinois the 7-day average of vaccines administered is down 60%. For the northwest regions, demand dipping 54%. In the suburban regions, including Cook County, there's a decrease of 46%, and Chicago seeing a 48% drop over the same period.
We have a long way to go still in terms of working on access, working on convenience, working on that confidence building.
Chicago's top public health doctor telling the I-team the city is rolling out new strategies, including gentle incentives to reach the unvaccinated.
It doesn't do us any good to have one part of the city 90% vaccinated and one part 30% vaccinated. You'll just see COVID keep showing up in those parts of the city that are less vaccinated.
It's not a question of being, finger wagging or saying you have to do this because I'm your doctor and I'm the authority here, but it's a question of being hopefully a trusted source of information around this.
Across the state, health officials are also adjusting their sales pitch and planning to bring the vaccine to smaller clinics and doctors' offices in hopes of reigniting demand.
We're going to have to really get into a more ground game, if you will, to really deal with the uncertainty and the concerns that our residents have.
We have to let people know that there are people who care enough to get out here and walk these streets and try to get you vaccinated so we can all be protected.
In another sign of decreasing vaccine interest, several states, including Illinois, are no longer ordering their full allocation of doses from the federal government. White House advisors are acknowledging vaccine rates have plateaued in some parts of the country, which could create pockets of risk for future outbreaks.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.